Before we come to all of that, let's get more on our top story then. NHS England have confirmed that children will no longer routinely be prescribed puberty blockers at gender identity clinics. The decision comes after a review said there wasn't enough evidence that they are safe or effective. Now, puberty blockers pause the physical changes of puberty and will now only be available as part of research. Fewer than 100 young people in England are currently prescribed them on the NHS. Clio Madeleine is from the organisation Gendered Intelligence. Morning, Clio.
Morning. Thanks so much for having me.
No, it's nice to talk to you. So this review carried out by NHS England essentially says we don't really know yet what the long-term impact of taking these puberty blockers are. So we can't say for sure that they're safe. Can you see why they've decided to act with caution here?
It's sometimes frustrating to hear that when it feels like NHS England isn't necessarily engaging with all the available research here. You know, I'm really in favour of building more evidence around what is fundamentally an under-researched area of healthcare. But the reason it's under-researched is because increasingly medical professionals don't want to sort of get near the healthcare of trans people because they're under so much political pressure. You know, if we look to the United States, to the Netherlands, to lots of other places around the world with really advanced provision of gender identity services, there is research there for the positive outcomes of puberty suppressing hormones. So while I really admire and support the NHS's drive to build better research, I think, or I worry that the way we're doing it is coming at a cost to the young people who do need medical interventions.
Yeah, that makes sense. There definitely does seem to be an acute need for more research, more data in this area. But even in the US, as I understand it, but you can correct me if I'm wrong, the use of these puberty blockers is not based on medical evidence and they're not approved for use in these particular situations.
So there's quite a common misconception here around what's meant by approved. There are lots and lots of medicines that are used off-label in pediatric medicine because in the pharmaceutical industry, lots and lots of medicines aren't specifically designed or specifically tested for use in children. We just know that they work through sort of the evidence that's built up over time through their clinical use in the same way that these medicines have been used in young people. And I will say, as you mentioned, in very, very small numbers, in very, very specific cases in the UK since, I think, the early 1990s. So this isn't anything that's new or dangerous so much as it's a fact of operating in pediatric medicine. You know, if we were to start restricting the way we use medicines on children in the UK because they're off-label or because they're used sort of outside their express use, then we'd be cutting off about half of pediatric medicine.
Yeah, I understand that. Although the NHS say they have carried out this systemic review of all available evidence. And I guess when we're talking about young people who are at a very sensitive point in their physical and their brain development as well, we don't really know, if we're honest, what hormonal treatment like this can do long term in 30 or 40 or 50 years' time.
It's true that we have very little in the way of longitudinal studies, that is studies that look at what happens in 30 or 40 years. But as I say, a lot of that is because there just isn't that much research on the trans community because people have been so unwilling to make that kind of research of it on us because funders have been unwilling to come near that kind of research. But what we do know from all available research we have on trans people, on the trans community, is that for people who do need medical interventions, those medical interventions improve quality of life, they improve mental health. I think what I really want to do is look at the big picture. There's such a small number of young people who are offered these treatments on the NHS as it stands. And moving forwards, the NHS is looking at continuing to provide these treatments as part of a research protocol. I think that, you know, less than 100 people aren't the ones who are going to be most seriously affected by this policy. The people who are going to be most seriously affected by it are the rest of trans people whose doctors are going to be less willing to treat trans people, whose educators are going to view this as a broader ban on sort of young trans people expressing themselves at
So
schools. Let's
you
see.
feel it sends out a broader message really about the trans community.
In this current political climate, I'm afraid it does. We've seen a rising tide of anti-trans sentiment coming from the government, coming from the headlines. And what we're really worried about is that this policy is going to be viewed as I suppose, support of those messages from the healthcare institution. We know already that there's this really terrible loss of faith between the queer community and the healthcare institutions of this country. And what we want to do is try and rebuild those. And policies like this that seem to restrict or to delay access to healthcare for trans people, unfortunately, they make that divide wider.
And there is a really acute need to address the huge waiting list of thousands of young people who are in some kind of gender related distress. So that is something that needs to be looked at. So the NHS England is now saying they're going to divert their resources into these new services, which they say will include experts also in things like neurodiversity, mental health, and general paediatrics, that they hope will better address the multiple symptoms that children questioning their gender tend to present with. Do you think that feels like a positive step forward?
I would say that we welcome a holistic approach to it. One of the things our organization does is provide youth work for trans young people, some of the most vulnerable young people in the country. And they urgently do need better support with things like mental health. I suppose my concern is that given the state of the services that we've had up to this point, there's a danger that we're robbing Peter to pay Paul. Like, if we are talking about bringing in more specialists who can look at complex mental health needs, who can look at neurodiversity, then that's great. But it's got to come in the context of a properly funded system of gender identity services. It's all very well to say that we're going to bring in sort of new specialists and new practitioners, but if the fundamental problem of a service that isn't fit for purpose continues, then we're going to continue in this vein of having 8,000 young people on waiting lists for years and years and years. It's no good if there's specialist treatment available if they can't get into it in the first place. And unfortunately, that's what we're seeing at the moment.
And you refer to those thousands on the waiting list. Can you explain? Because I think for some people not familiar with, perhaps not comfortable with the whole discussion around gender identity, they don't understand why there has been this rise in young people questioning their gender over the last, I guess, decade or two. Can you try and explain that for us?
Yeah, absolutely. And I completely get why it can be an uncomfortable conversation to have. Like, it is, if it's something you're not familiar with, it is strange, right? So over the past, let's say, 30 years at this point, maybe coming on to 40 years at this point, the visibility of trans people in popular culture, in public life, has gradually increased. And with that, you've had more availability to all of us, really. And I would say there's not a particularly disproportionate rise in gender questioning among young people, but across all ages of people, who can now see trans people and think, well, maybe that might be me. And one of the things that's gone along with that is that the gender identity services in this country, again, have become more public, and more people have thought that medical transition might be the right route for them. So that's why we've seen a sort of rise in approaches to the services. And I want to stress that not only are lots of these approaches from people who just want to talk to a professional about the questions they've got about gender, or from the families and carers of young people who just want to talk to a professional about these questions, but also that approaching these services, or even just asking questions about gender of yourself, of your family, of your teachers, that doesn't necessarily mean medical treatment. And in fact, I'd strongly encourage that everyone is able to ask those questions without teachers, parents, doctors immediately thinking, oh my God, this means puberty blockers, oh my God, this means medical treatments.
Having
I think
open
what
conversations. Yeah. No, I hear
exactly,
you.
yeah.
Okay. Cleo, thank you so much for talking to us. So we'll have to leave it there, but appreciate your time this morning. Clio Madeleine from the organisation Gendered Intelligence. 16 minutes past 8.